Kaji.
Namaste, Apurva ji. Welcome.
Welcome, Apurva ji.
Thank you.
Namaste and good morning, everyone. I welcome you all to this 25th session of Pharmacological and Therapeutic Effects of Top 75 Traditional Ayurvedic Medicines, which concludes our first series of 75 lectures divided into 3 parts. We at Canada India Foundation since COVID, along with many world-renowned experts on the subject and various important stakeholders like International Ayurveda League, Canadian Ayurvedic Practitioners Association, American Association of Ayurvedic Professionals, European Ayurveda Association, Association Ayurveda Academy CIC, Ayurveda Union of Midwest, and of course, Canadian College of Ayurveda and Yoga and Consulate General of India have been committed to bringing benefits of Ayurveda's wellness to all Canadian North American homes. I'm very happy to share with all of you that with support from each one of you, Ayurveda has become a discussion point and a serious option to be considered to address long-term health and wellness of all Canadians. Recently, Canada India Foundation kick-started International Yoga Day celebrations at Queen's Park in presence of many policymakers and elected representatives, which is a great news for all of us. Ayurveda is one of the sessions at upcoming National Conference of Communicable Diseases in Toronto later this month, with participation from Dr. Tanuja Nisari, who will represent All India Institute of Ayurveda and Ministry of Ayush at that event. So we all have collectively made some progress to help humanity, and we all should be very proud of our culture, tradition, and ancient wisdom of Sarve Bhavantu Sukhine, Sarve Santu Nirame. May all be happy, may all be disease-free. Without taking much of your time, I would like to invite our CGI, Consulate General of India, Purva Srivastav ji, to say a few words, and then we'll hear from all the experts we have today. Thank you.
थैंक यू रितेश नमस्कार आप सभी लोगों को बहुत बहुत नमस्कार और दिस इज़ अ ग्रेट प्लेजर फॉर मी टू कम टू बी इनवाइटेड फॉर दिस 25th episode of this discussion that you have been doing. This has, as Ritesh has already mentioned, it has done great. It has been instrumental in raising the awareness about recognition of Ayurveda in Canada, in Ontario to begin with, in Canada, and you all have come together to tell people about the importance of this ancient wisdom from India and the need of integrative medicines. And I have been discussing, I go to various colleges to meet the students, and I have always raised this issue with all the universities and colleges, and at least people are aware of it, and they agree to the need of this ancient wisdom to be part of the whole thing. And I think we have done 25 sessions of this earlier. This is the next 25th session, so a total of 50 sessions we have done, and a lot of people attend and hear about it, and CIF has also circulates in among other policymakers. On 1st June also, where a lot of member of legislative assemblies were there, MPPs were there. There also this need was discussed to have recognition of Ayurveda. So I think we are all doing a great job together, and a little maybe the next, there are 250 more sessions left, as I hear from Ritesh. So I think by the time we all should work together individually and collectively to have this ancient wisdom recognized here. And I would like to thank all of you for this consistent effort. I mean, because making an effort is important, but this consistency and discipline of doing it for last 2.5 years, it requires a lot of effort, a lot of perseverance. So I want to thank CIF for this, Harish ji for this, and all of you for this wonderful efforts. And as a Consulate General of India, we are there to support you. Just to say my goodbye, I think this is the last Ayurveda session I'm attending. I leave next month, but I'll be there in Slovakia, and would be very happy to attend if you do something there in Europe. Thank you so much.
Thank you so much, Apurva ji. This wouldn't have been possible without your support. You were the actually torch bearer for this initiative, and along with help from Dr. Harish Verma and all others present, Dr. Madan, everybody, we've been able to achieve, what we wanted to achieve for overall health of Canadians. We really, really thank you, and we'll miss you, but we'll use that rain check which you have given us to join from Slovakia as well. So I'll pass on to Dr. Harish Verma because, we've always talked about in 90 minutes, it's hard to cover all of that. So I wouldn't take much time. Dr. Harish Verma, over to you.
Thank you, Ritesh ji. Thank you, Ritesh ji. And friends, good morning in Canada and US friends, and good afternoon in UK and Europe, and good evening in India and Sri Lanka. Welcome to 25th session of virtual lecture series on pharmacological and therapeutic effects of top 75 traditional Ayurvedic medicines. Friends, we are running this virtual lecture series from Canada with the support of Canada-India Foundation, Toronto, Consulate General of India, Toronto, National Consortium of Ayurveda Medicine, USA, American Association of Ayurvedic Professionals, USA, Ayurveda Union of Midwest, Chicago, USA, European Ayurveda Association, Germany, Association of Ayurveda Academy, UK, International Ayurveda League, India, Tatha Astu, USA, and our media partners in Europe, UK, Canada, and USA. Today, the topic is pharmacological and therapeutic effects of Rasayana Churna. Rasayana Churna is a traditional Ayurvedic medicine which contains 3 ingredients, Amalaki, Guduchi, and Gokshur, which are well-known drugs for their rich antioxidant, immunomodulator, and renoprotective properties. It is a very good drug for renal failure. Our experts will tell. Rasayana Churna can be used from childhood to prevent refractive errors in children of modern era. One clinical study shows positive effect of Rasayana Churna on myopia. Today we have 2 expert speakers. We have Dr. Prakash Hegde with us, who is a BMS, MD, PhD in Ayurveda and currently working as Professor of Dravya Guna at SDM College of Ayurveda and Hospital, Hassan, Karnataka. He has published many research articles in peer-reviewed journals and given many presentations in different national and international seminars. He had done a lot of work in diabetes reversal program through herbal medicines. He is a member of Pharmacopoeia Committee in India. Welcome, Dr. Hegde ji. Thank you, sir, for joining. And friends, we have with us today Dr. Milind Jani, who has practiced Western medicine in UK for last 30 years and highly skilled surgeon, general practitioner, and he's a Ayurvedic doctor too. He runs a private general practice in UK and he uses his own synthesis of modern medicine with Ayurvedic medicine. This allows him to offer unique and holistic program for disease management and general health, focusing on body, mind, and spirit. Dr. Milind Jani regularly gives lectures to doctors and complementary practitioners in UK and abroad. Welcome, Dr. Jani ji, to our program. Friends, today we have 2 special guests. We have with us Dr. Ashwini Kumar Rao ji from Mumbai, who is BMS and MD in Ayurveda. He's a director of clinical research and integrative medicine at Medical Research Center, Kasturba Health Society, Mumbai. He's also member of Scientific Advisor Group of Clinical Research for Ayurveda, Ministry of Ayush, Government of India. Welcome, Dr. Ashwini Rao ji. Thank you, sir, for joining. And friends, we have with us Dr. Diana Luri, who is PhD in neuroscience and Professor Emeritus at University of Montana, USA. Dr. Luri's current focus is finding the intersections between Ayurveda and current biomedical research, particularly in area of neuroinflammation. She is also certified Ayurvedic practitioner, and currently she is the chair of NAMA Certification Board. Welcome, Dr. Luriji. And we have Dr. Madan Thangaveluji with us from Cambridge, UK. He's a genome scientist. Dr. Madanji will moderate the technical session of today's lecture. Friends, before we proceed, I would like to mention that we shall start part 2 of this 10 lecture series from 1st of October 2023. And first lecture will be on pharmacological and therapeutic effects of Punarnava Astakwa. So without wasting any time further, I would like to invite Dr. Madan Thangaveluji to moderate the session. Over to Dr. Madanji. Sir, unmute. Please unmute.
Thank you. Thank you for bringing us all together. Ritesh ji, namaskar. Thank you to CIF for being an anchor for bringing all of us together. Now, today we will listen to how a combination of 3 herbs, which when put together provides some incredible therapeutic benefits. And to put all this in context, I just want to share a few slides, particularly about where these sessions, the use of the phrase traditional Ayurvedic medicine, and where all this might fit into, and where our general consensus about where we would like discussions to go and where we would like to see future projects develop. These are the 3 plants we are going to discuss today: Phyllanthus Emblica, Tribulus terrestris, and Tinospora cordifolia. What happens when you mix these 3 things together, and how come it can be so magnificent in how it works? Now, you will find there are many aspects that are common knowledge in India, but might feel strange to people who are not familiar with the system, particularly these common names. And we have a very large storehouse of this information. Over the millennia, we've gathered all this information. There is a database where much of this is available, about 6,200 medicinal plant species, and almost 120,000 vernacular names from 12 languages across India, accessible and searchable. So there is a lot of work going on in India to put information together, accessible for the world. And I want to highlight particularly the work that's going on in Gujarat, the Ayurveda University in Jamnagar, and a research journal that's published by the university called Ayu. Again, accessible to all from on the internet. The mission of this journal was the global propagation of Ayurveda. And you can see on the left-hand side, the vision is very clear. It wants to be a custodian of classical Ayurvedic knowledge and help improve Ayurvedic manpower, research, training, teaching, etc., and so on. The objectives, again, these are all very clearly displayed in the journal website. The institute where this comes out of was established 1952. For us, that 52, 53 time period is very interesting, because 53 is when the structure of DNA was discovered here at Cambridge. So in 70 years, we can see where DNA has gone and where this ancient science of Ayurveda still could do much more. There is great excitement in India, around the world, regarding the WHO Global Center for Traditional Medicine that's established in this town, in the city of Jamnagar. And again, from the WHO website, you can gather a lot of information about that big initiative that's going on. The WHO GCTM. It has this reason why it's there, the contribution of traditional medicine to global health and sustainable development. These are very big challenges, the health challenge, and how we can bring traditional systems into. At the same time, how can we respect local heritages, resources, and rights? These are very difficult things and harnessing the potential of traditional medicine. Emphasize the phrase traditional medicine. And you can see there is a whole philosophical background to this thinking, which is the concept of Vasudhaiva Kudumbakam, that the entire world is a family. There is knowledge in many parts of the world that can come together to benefit all. Now, the first global summit for the WHO Traditional Medicine Center will be held later this year, 17th and 18th of August, 2023. It'll be at a time when India is also holding the presidency of the G20 summit. This platform is very important. It'll bring not only stakeholders, traditional medicine workers, communities from around the world, national policymakers, etc., etc. And at this event in August, we will have the G20 health ministers meeting in Jamnagar. I finished there just to put the whole thing in context, and we're very fortunate to have very senior members here with us, and want to bring in Dr. Ashwini Rao, joining us from Mumbai, who's been working for many decades in Mumbai at the Kasturba Gandhi Health Science Center. He will tell us a little more. To put this again in that wide context and into a finer point, Ashwinji, I'd like you to tell us how you people are addressing this at the large scale in terms of Jamnagar. You have studied in BHU, and you have a family that has over 3 generations of Ayurveda within. How are we going to put this in context in terms of the big picture and in terms of what perhaps Canada and Toronto would like to have? You know, there are ongoing discussions with university health networks in Toronto. Is there some way we can make these interactions more vibrant? I'll let you improvise, but I thought it'll be a good way to get you started. I know you have, for viewers, I'm taking the liberty of disclosing a little more. We have a brother-sister team here. Ashwini's sister, who is here with us, joins us as part of our team. And it is not just a brother-sister interaction here. This is generations of knowledge. So their family has, as I said, over 3 or 4 generations of Ayurveda within. And maybe that is what we need if we want to master this knowledge and make it available for the world. Ashwiniji, namaskar. Thank you for joining us from Mumbai.
Thank you, Dr. Madan, for that nice introduction. And your question, how globally our science of Ayurveda can be integrated and practiced everywhere in the world. First thing, let me tell you, and I must congratulate the initiatives taken by the Canada government and the people from the Canada and the practitioners from the Canada. Similarly, things are happening at US, I know, UK also, and at some places in Europe. But the most favorable thing is, you just now said about Jamnagar's history. You know that BHU's history is much more earlier than that, which have been working on the integration of medical streams. Now is the most favorable time. The Ministry of Ayush is very open for having such integrative approach, but with a evidence-based. So the Shastra has been there practiced in this country for several centuries or millennia. But now to that Shastra, we want to have the strong evidence-based to the application of current science. And that is what the current government, central government, is strongly promoting and supporting the Ministry of Ayush. Now coming to the critical, today's topic, we have taken the Rasayana Churna, which we all know is a very simple 3 plant-based formulation. And all these 3 plants are well described in all Bruhatrayis, that is Charak, Sushruta and Bhagavad, the classical text of Ayurveda, and has been practiced over millennia. It may not be that Rasayana Churna as such is practiced everywhere, but each plant of Rasayana Churna is very well practiced in clinically over the millennia, and it's still prevalent practice. What I wanted to say that we have also worked on in these individual plants like Amalaki, Gokshuru and Guduchi in different ways, in different clinical trials for different indications. what we need to do at this stage, we have to address this problem at multiple levels of institutions and multiple levels of organizations. That means these plants, its resourcing has to be properly ensured. So we need to address its cultivation aspects so that the plant identification is appropriate. Then comes the formulation development, how each plant is developed and how each plant is practiced. In the sense, a traditional formulation, there can be an extractive process. We know nowadays that extractives, again, there are some restriction. If you see the Ayush guidelines, which are only aqueous, alcoholic, or some oil and ghee extracts. But one can also go beyond that, different solvent system. So how these different products at different levels can be developed, standardized, and practiced. As I said, the things are already being practiced. Simultaneously, we can have observational therapeutics or kind of a pharmacoepidemiological observations and data record system. All this experiential data, if we record, then we can have definite hints of to what targeted indication this particular plant or the formulation of Rasayana Churna is effective. Once we know that, there is extensive data. If you see the in vitro, in vivo animal studies, that the safety has been well established. Now what we want to see that how a different kind of formulation will have a specific targeted activity. And if you can demonstrate that with a simultaneous paraclinical activity, clinical studies as well as paraclinical studies, if we do it effectively simultaneously with multiple institutes getting involved internationally, the time frame of taking really the strong evidence-based product is very much shortened. I personally believe, and our institution believes in reverse pharmacology, and we believe that within 3 to 5 years we can have a very strong evidence base of a product. So it can be kind of brought back with the science inputs in this and strong evidence base with a targeted indication. It can be brought to the use of larger population of the global.
Ashwini-ji, thank you so much. Now, we'll go to Professor Diana Laurie. Diana, thank you so much for joining us from wherever you are today.
I'm in Montana.
Montana, thank you so much for. Now, Diana, what we are seeing here is how easily we can connect the world. This was something that was not possible before. And what we've seen, what Ashwini-ji mentioned, the depth of knowledge that is there, and over thousands of years, refined sometimes locally using local terms and local worldview, but giving rise to a system that has prevailed the ages, and it's here with us today. And you can see how it is being leveraged to address global health challenges. And you have drifted into this. All I know is from your published papers and neuroinflammation and Brahmi and how it works. You have drifted into this for some reason, for some excitement. There is something that's brought you into this world. Please tell us a little more, and your vision, the vision in your mind of where we should be positioning ourselves and where we should be going in the future.
Okay, well, thank you so much for the invitation to speak with you. It's really encouraging to see so many people from so many different countries with different backgrounds coming together over Ayurveda. And my story is a little bit interesting. So I'm trained as a neuroscientist and I work in a school of pharmacy. And about 15 years ago, I felt like I'd reached a dead end in my neuroscience research, that I didn't quite know where to take it. And at the time I was doing yoga, and I had a subscription to Yoga Magazine, and I'm looking through it, and at the back was an advertisement from Kerala Ayurveda for training in Ayurveda. And I'd never heard about Ayurveda. So I thought, oh, that's kind of interesting. And I looked it up and learned a little bit about Ayurveda. And what appealed to me at the time, not knowing anything about Ayurveda as a scientist, was the concept of dosha. And the idea that there would, at some level, there's an underpinning of a genetic component to dosha. And so that really interested me. And I thought, well, maybe what I need to do in terms of my research, because I was involved in biomedical research in the nervous system, was think about physiology from a different lens, not just from the Western biomedical lens, but from a different perspective. And that might help me figure out where I wanted to go next with my research. And so I trained with Kerala Ayurveda in the United States and spent a month in India at an Ayurvedic hospital. And it really transformed my whole vision of physiology and health. And the two concepts that really struck me from Ayurveda was the concept of the importance of digestion and the concept of inflammation. And so I ended up sort of re-gearing my research to look at neuroinflammation and the effect of some of the Ayurvedic herbs that are targeting the nervous system to see how they influenced neuroinflammation. And I also taught an overview of Ayurveda to our pharmacy students, which was a very popular elective. And so it was very interesting for me because it was almost like I was rediscovering knowledge that at some point was familiar to me. And so my vision and my goal now moving through is to integrate concepts of Ayurveda, treatments of Ayurveda into our medical system. And my pharmacy students were very responsive to the concepts that are part of Ayurveda. And I think that part of what I do when I publish and is not just my own research, but I try and find science that supports the concepts of Ayurveda, even though that research has not been designed to study Ayurveda. So the whole concept of the gut microbiome, which has exploded in the last, 5 to 8 years, all supports the concepts of Ayurveda. But in the United States, you have to follow the guidelines that are set for the health professions in the United States. And I'm very aware of this being in the School of Pharmacy. And that's why I have agreed to be the chair of the NAMA Certification Board, because we are trying to move the profession in the United States towards licensure, which is basically what is needed if Ayurveda is going to take its place among integrative health centers in a similar way as naturopathy and traditional Chinese medicine has. And so our group is overseeing continuing education credits. We've spent tens of thousands of dollars developing certification exams that meet all the requirements of other board exams and certification exams for the health professions in the United States. And so we have to take the tradition of Ayurveda and move it into a framework within the United States that's going to be recognized by other health professions in the United States. And I think it's very, very powerful. And my vision for Ayurveda is that it will be in the future a licensed profession in the United States, and that it will take its place in integrative health centers along with Western medicine, traditional Chinese medicine, and acupuncture and naturopathy. And so that's kind of my goal, and that's where my science and my intellectual interest is to find intersections between that biomedical research and Ayurveda.
Diana, thank you. You make, on one hand, you make it sound so easy to do the connection, to do the transition from one system of thinking to another system of thinking, basically systems of thinking. On the other hand, the regulatory challenges, very quickly, are these easy to overcome? Are these
I think anything, if you put your mind to it, is easy to overcome. That's what I believe. It takes time. It takes time to develop the pieces that you need. And and put those into place and have members of the profession recognize the importance of that. So an example is our board exams and our certification exams. And we work with an external company who has developed other certification exams and board exams for other professions. And so there's a lot that goes into developing those exams. We have to follow best practices so that our exams are defensible and are legally good. So that part of it is challenging. And then it's challenging for a profession like Ayurveda that is growing and developing in the West to recognize the importance of following some of these guidelines from the Department of Education, from other licensing boards, because in some cases it seems a little bit antithetical to the concepts in Ayurveda, you know, because everything's very individualized and personalized, but we still have to fit into that framework that's recognized by the West and by licensing agencies in the United States. And that, I think, is what the public wants. And obviously that's what some of the regulatory agencies want.
Janet, thank you so much. Again, you're very, very clear in how you're approaching this whole problem. And like your comment that if you stay with it for long enough, we can resolve all these problems. We are very fortunate to have here with us today Dr. Baswati Bhattacharya, who's a person who's done this transition for herself, where she's done her early studies in America and then did a PhD in India and is now shuttling between not just India and North America, but also India and Europe. She's involved in the World Health Congress that's coming up in Prague in September. And Baswati, before I come to you, I just want to take a quick comment, very brief comment from Dr. Ashwini Raut about what he has heard from Dr. Professor Lowry. Ashwini-ji, do you feel happy to hear the comments from Professor Lowry? Is there something?
Yeah, surely there were two things came to my mind. One is the activity that has been undertaken by NAMA regarding the training modules, you know, open to those who really wish to learn. And second thing, what she talked about, I talked about the product. She talked about the concept. We need both the things. The product will appeal to the people, community, if it is really effective. And the concept is needed whenever there is an educational system, education is imparted. So if the concepts are made stronger and imparted proper knowledge based on the concepts, Ayurvedic fundamentals, and if you really focus on that in your training modules, that will give us a good dividends. That's my
Thank you, Ashwini-ji, very important point. Please stay with us. Dan, please stay with us. As I said, I have the unenvious task of trying to do this whole thing in 90 minutes. So please stay with us. We'll find time to come back to this point. Baswati-ji, thank you so much for joining us from New York. I assume you're in New York today. Thank you for joining us.
I'm in New York. Thank you for having me. So, you know, I stayed at Ashwini Kumar's house, thanks to Ashlesha, way back some years ago. So it's nice to see you, Dr. Rao. Nice to see you. And I think I know that room, actually.
Same room I'm sitting, my study room. Yeah.
Yes. And I actually did my undergraduate at Penn. And when I started my PhD, I submatriculated into the Department of Pharmacology and focused on neuroscience in the same department as Diana. So I've known Diana since the 1980s. And I remember she and I used to be running around in the labs doing our work and sitting in seminars together. So it's nice to see these people who, I've known that Dr. Raut actually was at BHU and focused on Ayurveda his entire career, but on mainstreaming it in especially the Bombay population when he was head of the NEMA, the National Integrated Medical Association. And he was very much trying to unite this. So I think your question to me, Madan, was that you want to know how, well, tell me what your exact question is.
The question is, I mean, we've seen the ease with which you people have shuttled, you know, Diane does it so fluently. And you have done, not only did your MD, MPH in America, but also did a PhD in India, and you seem to do it fluently. Is there something missing with the rest of the community?
It's missing in the teaching.
Teaching.
It is very easy for those of us who have mastered it to see a patient, because that's ultimately, you know, we're all looking at the mountain, but we're on different sides of the mountain. Allopathy goes up the mountain this way, Ayurveda goes up this way, homeopathy goes up this way, osteopathy goes up that way. So if we can look at the mountain and say, we're all looking at the patient, we're all trying to help the patient get better. That is where our union can be. That is where we can learn from each other, you know, tricks of going up the mountain, our own way, our own path, but maybe some tools that the others use. But we must master our own path. I can't just jump from my path to another until I've mastered it. So whatever stream you start with, whether it's biomedical science like Diana and I did, or whether it's allopathic medicine, which I later did, and that Dr. Jani also did, or whether it's starting with Ayurveda, like many people here, and then moving toward trying to understand some biomedical concepts. It can be done, but it has to be clearly understood why the body is being seen this way and how the medicines are actually working on the body. One of the things that I found as a pharmacologist and a neuroscientist is that we don't have actually any idea of Nidan Samprapti, which is the origin of where the disease comes. Modern medicine is a naming science. What we do is we see something, we observe it, and we name it. We call it a structure, or we say, we think the function is this way, but we don't put it together and say, why did this structure require to be evolved into the material world of the body from this function that was needed? Or why did this function develop because this structure happened to be here? And if you can understand what Diana called the physiology, or what we can call the Rachna Sharir, Kriya Sharir, then you can understand why Ayurveda says from this structure's gone wrong, you know, something that's mishapped or misstructured or traumatized or infested or infected by inflammation or by the process of a very low level cellular inflammation, which is jwara, how that can grow into a pathology. That pathology then can be understood. And there are many, many scientists who are going back and forth. But if they're not taught in a system that exposes them to the science and asks the question and says, how do other sciences answer it? Acupuncture uses meridians to connect the energy between different organs, which may seem unrelated, but they are very much related because of the flow of energies. If you look at the umbilical system, I just opened up this morning for a discussion, Keith Moore, my anatomy text. There's nothing written on the umbilicus, and yet this was the source of the dhamani, the beating of the pulsing, right, of the fluid and the nutrients that came from the mother through the placenta, through that umbilicus cord into what was a forming body. If we start with embryology and we see how things function normally, and then we move into pathology, if the medical students can learn embryology better, and if they can understand the process of embryology into physiology and then pathology, I think it's very easy to understand. And when I came to it as already a practicing doctor, wanting to learn Ayurveda and finding out why these clinical realities were there in Ayurveda, but ignored by modern medicine, I kind of confronted modern medicine and said, look, you say this is incurable using this black bag, but Ayurveda has these tools, panchakarma, bhasmas, various herbal formulations, and the concept of shodhana, then rasayana. How come we don't put that into our black bag in modern medicine? And the answers that came were quite disturbing, actually. And I think that's what some of our doctors here know about. And I think that if we can teach that in the medical schools and teach people to ask questions, new critical thinking, and not just rote memorization, then they themselves will come up with these questions and start answering them the way that I did, the way that Ashwini Kumar and Diana and everyone here who's actually curious in integration, how we did it.
Thanks, Bash. I'm going to stop you. I'm
Yes.
going to stop you here.
Done.
But this is the quality of engagement we hope we will have at many discussions that are going on around the world. Diana, please stay with us. Ashwini-ji, please stay with us. And I want to bring in Pallavi-ji. Pallavi-ji, the floor is yours.
Yeah. Dhanvantaraya Namaha. Thank you, Dr. Madan.
I just want to, before we go on to the expert speakers, I just want to mention that Azadi Ka Amrut Mahotsav, that is, we are celebrating 75 years of independence. And in relation to that, Harish ji started these 75 lectures of virtual lecture series on traditional Ayurvedic medicine. And it was a wonderful journey. We started on 19th of June last year. And today we are completing the first set of 25 lecture series. And it has been wonderful sharing knowledge and enlightening with therapeutic applications with the viewers. And I totally wish best to all, everyone. And we were honored with such beautiful and such knowledgeable speakers who came and shared their knowledge with us. Next, as Dr. Harish ji mentioned, we will be reuniting on 1st of October, and the topic will be Punarnavadi Kwat, Punarava Ashtak Kwat. And so I just request all our viewers and respected dignitaries to stay tuned with us. Thank you. And let's listen to the experts today. We are anxious to listen from you. Thank you. Thank you, Madanji.
Pallavi, thank you so much. This is, I just repeat what was said earlier. We have come up to the 25th session today, and we'll draw a line here as the part one of consolidating the program. And we'll hear more about it from Harish ji as we come to the conclusion. Thank you so much. We now move to our first expert speaker, Prakash ji Hegde ji. Prakash ji, namaskar. Namaste.
Namaste.
Thank you. Thank you for joining. Now, once again, we are limited for time. Be as quick as you can. Give us the depth of what you want to share so that we are excited to keep us on our toes. Thank you.
Yeah, I think the screen is visible.
Visible. If you put it to presentation mode, then we'll enjoy you.
Is it fine?
I can also see a hashed box on the left-hand side of your screen. Looks like you have another window open.
Okay. Now it's clear?
No, you have to select your window carefully.
Yeah, it's fine. For me,
No,
it's fine.
we can't see your slides. Please do start again.
Right. A second. Is it visible now?
If you go back to your first slide and put it to presentation mode. Thank you.
Clear?
Your first slide, please. No, we are not. It's not in the first slide. You might have to start again, your screen share again.
Okay, I'll do it. So 1 second.
On presentation mode.
Yes.
This is always, sometimes we have this difficulty. Apologies to viewers. Prakash, are you all right?
Yeah, it's
just
fine.
want to put the pressure on you a little bit for time. This is.
Yeah, I'll be, yeah. It's not possible now. I'll just share it once again, sir.
If it's going to take time, we will move on to our next speaker and come back to you.
No, I think it's okay, no?
No, we don't see your screen. Prakash, we will let you sort.
Fine. Is it fine?
It's not on presentation mode. We will let you sort this out. Maybe somebody, Pallavi ji or Harish ji will help you with this. We move on to Milan ji. Milan ji, namaskar. Thank you for joining us today. Milan ji, you have to unmute, please.
Unmute. Okay. Hello, everyone. Can I share my screen, please?
Thank you. If you could, thank you. That's it.
Okay. Well, as I said, good morning, Canada. Good evening, India, and good afternoon, UK and Europe. It's a great honor to be invited on this very elite and eminent webinar. Thank you to Dr. Harish Verma-ji, who, you know, we first met in the 90s, and it's an old sort of friendship. And Dr. Madanji, we've been talking for quite a while about various aspects of Ayurveda in UK and Europe. I'm not going to waste too much time in introducing and talking about that. As I've been asked to present on the pharmaceutical and therapeutic properties of Rasayana Churna, I'm going to try and keep it very focused on modern medical point of view with its applications, and I'm hoping I have made an endeavor to stimulate everybody's minds about understanding how these Ayurvedic herbs work at a deeper level, and then all the research that's been going on on the various Ayurvedic herbs. I've been reading that, so I'm going to try and highlight some of the pathways of action relating to the therapeutic effects, both from my personal experience and from the research and having spoken to so many Ayurvedic experts over the years. So this is Asmita. My Ayurveda was inspired by my wife, Asmita, who was the first Ayurvedic qualified doctor to start Ayurveda and Panchkarma in UK in 1988. She was from Jamnagar University. I also would like to say, like Dr. Madanji said, that there is a tradition in my family. My great-grandmother was the local village midwife and the herbalist. I don't know where she trained, but she was, and there must be some genes in me from there. And my maternal uncle, Dr. Ramesh Trivedi, was my godfather. He was trained both in modern medicine as well as Ayurveda. There used to be a long 7-year training course in the 50s and 60s. So I have a little bit of a genetic background on that. So the agenda here, as I said, first I'll start with a bit of introduction on the Rasayana and the professional medical side of it. We'll look at some of the pathways of inflammation and target remedial action. And we'll look then just a little bit of a brief touch on the pharmacology of each ingredient of the Rasayana and some of the therapeutic potentials, and I'll raise some questions. So I apologize if it's more focused on the modern medical point of view, but I would like to make this point that we all know that Ayurveda is much more holistic system. And also Acharya Vagpat has said that you should not give Rasayana therapy without preparation of the patient with the Shodhan, as Dr. Baishruji mentioned, or Amapachan, etc. So I just wanted to make that point. So here goes. That's my focus. As I said, we'll try and look at some of the modern medical point of view. So let us start here. Hang on, I just want to change this view of my, there you go. Here you are. So as we said, I thought I would again remind you of, these are the pictures I've taken myself of these at the Ayurveda nursery in Gandhinagar. And that is an Amla Farms, you can see that. So we've already know that Rasayana Churna is composed of 3 very potent herbs in Ayurveda, all 3 considered to be Rasayans. So Guduchi or Garo, Giloy, so many names, Tinospora, cordifolia, Gokshur, Tribulus terrestris, and Amla, Emblica, officinal. There are other names for that, but we'll skip that. So what is the primary therapeutic effects of Rasayana Churna? Let's try and do a summary of it. These are the medicinal effects that are mentioned and practiced by various eminent Ayurvedic practitioners and other practitioners. So you can see immunomodulatory, anti-diabetic, cardioprotective, anti-hypertensive, anti-inflammatory, anti-toxic, anti-cancer, antimicrobial, antioxidant. No wonder that it is considered to be a Rasayana, because it has got these multiple therapeutic actions on the body's tissues and the various organs. And here on the right-hand side, if you see the Ayurvedic texts on the Prabhava and Karma, you know, like Ashtanga Hridaya is the main one, which is, but a lot of you like Charak and Chakrapani Datta, they have mentioned this elaborately, and Gangadhar. I have referenced some of those. So you can see that as a Rasayana for sexual vigor is one of the most important indications where people have taken that. Stability, that could mean many things. Swasthya, the good health, is a general, again, which is very important, because at the end of the day, our focus, even today in modern medicine, you can see all the healthcare services in the NHS and the United States and everywhere are overwhelmed with modern medical therapy. So the focus now should be shifting towards how to maintain the swasthya, the good health of the population, so that we can reduce the budgets on treating illnesses. So that is the main focus of Ayurveda, if I may remind ourselves again. So then again, eradication of disease and that. So here is a question which I'm putting to all the Ayurvedic experts. Is it a rasayan or is it a bheshaj, a rejuvenator or a medicine? Now we've heard from so many, there's ample research and ample evidence from clinical practice over the last 50 years that the rasayans can work as both, either preventative or a medicine. So those are the two words that most Ayurvedic people will know, the swasthya urjaskar or ojaskar, which is the enhancement of the natural vitality. We won't go into the depths of definitions today for lack of time, or whether it is Ayurveda. So next point that I would like to highlight is, what is the key target for me as a medical doctor for the last 40 years, both as a surgeon and then as a general practitioner? It's very important. The biggest thing, the burden on society and on the healthcare systems is treatment of chronic disease. As you know, it runs into billions of pounds or dollars or rupees, if you like. And so this Rasayana Churna has always grabbed my attention. In fact, I'll show you that I have taken it personally over the years, and I have had very good results from that, and each ingredient as well. So just to show you that I'm not doing too bad for 70, and I do attribute a lot of that to yoga, meditation, the personality, genes, but also to taking some of the right Ayurvedic herbal rasayans. So you can see there could be these three targets, like the autoimmune diseases, like rheumatoid and lupus, because there's a lot of steroid burden and there's no satisfactory treatment. There's lots of undesirable side effects. These renal disorders, particularly in the prevention of diabetic and hypertensive nephropathy. And then, as we know, during the COVID-19 pandemic, there was so much evidence that come out in the studies of using Rasayana Churna for viral infections, and it's done very well. And what is our cue for that? The antibiotic resistance, which is the next epidemic, remember? So excuse me for going through these quickly because of time, but I hope that these highlights are some food for thought, and they are sort of very focused points that we are raising today. So it's important to understand how any medicine works, whether you understand it from the point of view of the Ayurvedic physiology, or whether we understand it now in the modern science from the pharmacokinetics or the pharmacological, the chemical pathways, if you like. And it is important nowadays, whether we like it or not, to confirm the traditional Ayurvedic medicine philosophies and all the physiologies and pathologies by modern science in terms of the chemicals and the phytochemistry, etc., and the pathways which the modern doctors understand, which the modern people understand. So I resonate with everything which our dear Professor Diana Lowry said, and Dr. Bhaswati, I think, very important in the Western world for us to try and bring the message home and get this licensed. So you can see just three main modes of the anti-inflammatory. A lot of research is being focused on cytokines and interleukins and interferons and masters. So I'm going to urge every Ayurvedic doctor or practitioners or integrated medicine practitioners or modern medicine practitioners to just have a think about this and look into it a little bit more about these definitive chemical pathways which Rasayana Churna is attributed to. It works in these or through these mediators, through these chemical mediators. And we will look at the Ayurvedic explanation of the way that the Rasayana Churna works and how it's explained in Ayurvedic terms, from the doshas and the shrotas and all that. So that will come later. So, and then the cell-mediated immunity with the CD4, CD8 count, that is again like, you know, we need to go back and revisit the immunity, how it works in the body. It's a very complex mechanism, and with the immunomodulator system. So these are some of the research on Rasayana Churna that I've been reading, also on individual herbs like Guduchi and Gokshur and Amla. And they have focused on these, which is the right thing to do, because then it increases our confidence, certainly my confidence as a modern doctor, on using this on patients or on myself, because then I understand it from my training, my point of view. And this, we go back to that you know, point which Dr. Bhaswati made about the teaching and the training. So here I've got some slides there, like the anti-inflammatory process, to remind us all these processes that take place when you give Rasayana Churna. The Amla, the Guduchi, and the Gokshur will work through these cytokines, and we do all this, you know, and the main thing that I want to highlight here is how they work on the cytokines here, right at the bottom there. So I'm highlighting 3 or 4 key mediators, key chemical mediators in this process on the action of Rasayana Churna and Indian herbs for the anti-inflammatory and the autoimmune effect of that. So through the cytokines and through the CG4, sorry, CD4, that should be CD4 and CD8, which is the T cell population. This is the main pathway for the action of enhancing the immunity, which worked during the COVID-19 pandemic. And so worth reading. And this is just a summary of all the various examples of immune response to cancer as an example, but the same would be true for treating severe viral infections like the COVID-19 or other infections, but also for any antigen load on that. You can see the protective immunity pathways, targets for research on this. And this is the Rasayana. That was a very nice figure I found, which actually, it really requires a little bit of, but it's quite simple, that you've got the B lymphocyte cells there, which give you the short-term 3-year memory for the future infections. The CD4 helper cells, which help with the production of the antibodies. That's a 15-year memory for, you know, immunity for future infections. And the CD8, the cytotoxic, or the phagocytosis and apoptosis, so killing the cells, whether that is viral cells or bacterial cells or tumor cells, that will be true. So you've got, let me just let's sit back on that basis of how the pathways of action. What about autoimmune diseases? The big, I feel that the Rasayana Churna is a very big promising medicine, which will find its way in the mainstream medicine, I think, with the right research and the right way that if it is presented and made. So you can see that autoimmune conditions, our own immune system attacks our tissues, environmental factors, toxins, infections, and stress can also lead to it. So it's important to address it. And this is where I feel that Rasayana Churna could act on both, because by helping to treat or prevent infections, by detoxifying and reducing the stress, which Guduchi has been shown to do on the central nervous system as an individual drug. And along that, I may also add here that I do feel that we need to look at ashwagandha, brahmi, and shatavari in addition to this, and atmagupta, which is conjugate. That's another discussion. So there you are. So here is another sort of tip for looking further into this. Consider Rasayana Churna and compare with the monoclonal antibody drugs for autoimmune diseases, which are specific antibodies for treating it. So you can see the immunosuppressant drugs used to treat many autoimmune diseases. And this is where we need to you know, clarify and present to the modern physicians like myself, that is Rasayana Churna or Guduchi an immunomodulator or immunosuppressant, or is it?
Milanji, thank you.
So that's the inflammatory. And so just now, I have personally used it there. And just winding up on that, so you're most welcome to share this, and these are on each individual herbs. Because of lack of time, I may not be able to go through all that, therefore my reference. But you're very welcome to share these with all the others. And the summary is that it could be a mainstream medicine, and that's, I do drink it. We need a healthy, so these are the 4 areas of focus: treating chronic disease, healthy aging, very important to reduce the burden on society, prevention of infections, treatment. The big question I want to put is, we lack in data from side effects to consider. For example, there's conflicting notion about Guduchi causing liver failure, liver cirrhosis, or treating it. And that's something which I'd love to learn from the experts. As Charak said, specific knowledge about drugs is obtained through scientifically based deductions. That is what we are doing. Thank you so much for listening to me. And I hope that I have given you some food for thought.
Milunji, thank you so much for taking us through this. We'll have to bring you back on to a more detailed discussion. If you stop sharing your screen, then we can see if Dr. Hegde is ready to join us. Thank you once again. Please stay with us. There'll be questions.
Lovely.
As I said, we are rushing through in 90 minutes. There are only tasters. And there's a Guduchi drink there for.
Just if you haven't seen it, it tastes slightly bitter, and you add honey and a bit of rock salt to it.
Oh, wonderful. Thank you. Stay with us. Thank you for sharing those wonderful slides, images. The question running through my mind is whether it will take somebody to understand both the sides, that they will have to be a fellow of the Royal College of Surgeons, and they'll have to have 3 generations of Ayurveda in the family, in their genes. Is that what is needed to get Ayurveda into modern healthcare? Or is there some other way to get it in there? Hegdeji, thank you so much for joining us. Once again, I hope we've resolved the problem. Otherwise, we'll guide you through how to get your presentation on the screen. There we are. Thank you so much. The floor is yours. Hegdeji, a question that everybody asks before they come. We get a lot of questions come in. And the question, again, is the same. Could you tell our viewers very, very briefly how you came into Ayurveda, and why are you continuing to work with Ayurveda when the world seems to say we must be making monoclonal antibodies or we must be doing something else?
Okay, am I audible now?
We can hear you clearly, thank you.
Okay, slides are visible, I think.
Very.
Okay. Namaste. I would like to thank everyone for giving me this opportunity. And I'm Dr. Prakash Shinde. So first, before beginning my presentation, I would like to answer Dr. Madan Tangavelu's question. It's not by chance. I came into Ayurveda by choice, because my home god, because I belong to Dhanvantari Sampradaya, we have a temple in my native place. We are worshipping since 700 to 800 years. So that's how it created interest in me, and my forefathers and relatives, many relatives, they are practicing Ayurveda. With the common remedy, they were able to treat so many common ailments in everybody's house. That made me to have interest in Ayurveda, and that's how I came to Ayurveda. And now I am very happy that Ayurveda is gaining a lot of popularity, not only in India, throughout the world. And we should appreciate various hands which are coming together to bring back the glory of Ayurveda. Thank you so much for the opportunity. So I think I would like to start my presentation. I'll be speaking on pharmacological effects of Rasayana Churna. So as Rasayana Churna, it has got a reference from Ashtanga Hridaya Uttaratantra, has got 3 ingredients in it. They are Amalaki, Guduchi, and Gokshura. So here the fruits of Amalaki and Gokshura are used, and Guduchi we are using stem part. So here is the reference. So Churnam Shudam Stram Amalaka Amritanam Lihan Sasarpir Madhubhaga Mishram Vrashaha Stira Shanta Vikara Dukkha Samaha Shatam Jivati Krishna Keshaha. Very interesting reference from Ashtanga Hridaya Uttaratantra regarding Rasayana Churna here. So it says that it has to be taken with Anupana, that is a concept in Ayurveda. So with certain vehicle, we are using or taking the medicines. So here, when we are taking about Shodamshtra, that is Bokshura, and Amalaka and Amrita, we need to take it with Sarpi, that is ghee, or it should be taken with Madhu, that is honey. What happens? What is the outcome? Palashruti, what we say, Vrashaha, it keeps the person having a very good sexual vigor, and he'll be stable, and he'll be having a so calm mind, and Dukkha-sama, that means he can face any difficult situation. And very important thing here, specifically, it is said, Shatam Jivati Krishna Keshaha, means the person will live for 100 years, and even he's of 100 years, his hairs will be so black. So that says about the wonder or miracle effects of this Rasayana Churna. And before going in detail about Rasayana, let me answer the question which was raised by Dr. Milin sir regarding whether the Rasayana is only like it's a rejuvenator or it is a medicine. So answer here, it is both, because we have have types of Rasayana in Ayurveda. They are like, one is Kamya Rasayana and another one is Naimittika Rasayana. So the concept of Kamya Rasayana, it is like it rejuvenates us. Like if I want to have good memory, I should take Maidya, that is a Rasayana. Okay, but when we are having certain diseases, so we need to take particular medicine. For example, when it comes to Sandhi related diseases, or what we say joint disorders, where Gugulu becomes Rasayana. So that is Naimittika Rasayana. Gugulu is a drug which can be taken on everyday basis to have a better result from the disease condition. So that is the thing, wonder explanation which are having in our Ayurveda. So when coming to what is Rasayana, it's very nicely told in Ayurveda, that is Rasayanam cha tadnayam ijjara vyadhi nashanam yatha amrita ruddanti cha gugulucharitaki. So Rasayana, it is jara nashaka, that which postpones the old age, and one more is vyadhi nashaka, means it can act both as medicine and also rejuvenator. So what are the different benefits which we are getting from Rasayana, various Rasayana dravyas, including this Rasayana Churna? So it is very nicely said in Charaka Chikitsasana, first chapter, first pada, 7 to 8 shloka. It starts from Dirghamayu. So there are so many benefits which are explained regarding Rasayana dravyas in our Ayurveda. It starts from Dirghamayu, Smriti Medamarogyam Tarunam Mayaha, like that. So all the aspects of giving luster, giving a very long lifespan, giving a very good memory, giving a very good hair, everything comes under the ambit of Rasayana. So what are the common benefits from this Rasayana dravyas? Like even Rasayana Churna has got all these indications, which prevents aging, prevents diseases, prevents graying of hair and hair fall, maintains young age, improves body growth, improves eyesight, improves sexual capability. There are so many other things also when it comes to usefulness of Rasayana. So when it comes to these three drugs, these are the ingredients of Rasayana Churna. The first one is Amalaki. So everybody knows about the importance of this Amalaki. We say it is a boon which is given by our God for maintaining our health. So botanically, it is identified as Emblica officinalis. So these are the Ayurvedic pharmacodynamics which are mentioned, like Rasa Guna Viru Vipaka, we say always. So which has got mainly sour taste, but there is no lavana, that is salt taste. Remaining 5 tastes are there in this Amalaki. So this is a like special drug. There are different concepts which are told, like Madhura Vipaka and Shita Vida. So this aids the Rasayana karma. And these are the other karmas which are mentioned for this particular drug, like Rasayana, Pramehgna, Jwaragna, Vrashya, Medohara, Kesha, etc. So we can get the reference from Bhavaprakash Nigantu, Haritakya Varga. It says about, like, it has got similar properties to Haritaki. That is one more very important Rasayana Dravya. And apart from it, it is also very useful as Vrashya and Rasayana, it is said. Then what are the important chemical constants? Based on it, we can assume what are the possible pharmacological actions which we can expect from this drug. So it has got allergic acid, amylaic acid, like that. And also it is the rich source of vitamin C here. So that is a very important thing when it comes to Rasayana Karma. So these are the other clinical indications. So when we use this drug with various combinations, we can achieve all these success from all these diseases. Like it may be used as Vajikara, like it acts as Vrishya and Balya. Then it is very useful in Shita Pitta, that is urticaria. Again, very important conditions where we have so much of problem for the patients, like they are irritated for facing such diseases like Shita Pitta. Then when it comes to Palita, that is premature graying of hair, it's because of Kesha Karma, which is attributed to this Amalaki. It's used in case of Palita, premature graying of hair. And when it comes to diabetes, that is Prameha, it is wonderful drug and very commonly mixed with turmeric, actually. Prameha and in this case, Amalaki and this Nisha, that is, we have a famous formulation, that is Nisha Amalaki tablet. In the form of tablet also it is available, or it can be used in the form of churna to have this result. So there are many other karmas or actions which are attributed to this particular drug. What are the important pharmacological actions which are very important when it comes to Rasayana karma as such? So it is proved for its immunomodulatory activity, then it is known for its antioxidant activity, and it is also anti-carcinogenic too. So all these pharmacological actions, this is proving that it is a very good Rasayana Dravya. And there are various research works which are being conducted on this particular Amalaki, and they have got so much very good results out of it, like anti-aging potentials of phytoextract from this Amalaki, then vitamin C content and its antioxidant activity. There's so many things which are explained. And above all, there are so many experimental activities conducted on Amalaki Rasayana also. That is regarding one drug. Then moving on to the next one, that is Guduchi, Tinospora, cordifolia. Again, very, very commonly used drug everywhere now. And during this COVID, it has got a lot of importance. And all these like pharmacodynamics, which are explained in our classical text, like it is again having Madhura Vipaka, that is responsible for its Rasayana action. So this is the reference we have in our classical text. Like I have highlighted the important karma, that is Rasayani, and it is Balya also. Like it is very important drug when it comes to in the context of Medhya Rasayana also it is mentioned. And because of its zinc and copper elements, which is having its action on repairing the damage which has happened in the cells. It is a very good antioxidant also. Then coming on to the phytoconstants of this, there are a whole lot of chemical constants which are isolated from this particular drug, Tinospora cordifolia, like various alkaloids, sesquiterpenoids, phenolics, steroids. There are so many things which may be a very good thing we have to think to prove so many pharmacological actions which are attributed to Guduchi. So these are the clinical conditions apart from Rasayana karma, which is used in case of Jwara, that is as it is Jwarahara, antipyretic, it is used in case of Jwara. In different types of Jwara also it is used, like Vishama Jwara, and again very good anti-diabetic. In case of skin diseases also it is mentioned to have very good vision. This can be used in various diseases of eyes. And this is the pharmacological actions which are attributed to this Guduchi: antipyretic, diuretic, anti-inflammatory, and memory enhancer, like Medhya Rasayana also it is having. So this is few. These are the few research works which are done. Tinospora cordifolia, like immunomodulatory properties, is been proved. Then it's also proved for antioxidant activity.
Prakashi, my apologies. I'm going to stop you here. We want to quickly hear from you how this combination works.
Yes. I have an answer to it. So these are the three drugs, like Amalaki, Guduchi, and Gokshura. So here, as I said in earlier slides, like it is the Madhura Vipaka, which is very important when it comes to Rasayana karma. And moreover, all these are having Rasayana as a karma in their indications. And when it comes to Amalaki, it is very famous as Amalaki Vayasthapanana. That means Vayasthapana means which stops aging process, like it prevents commencement of old age. And also, like this Madhura Vipaka, Madhura Vipaka means like once it undergoes digestion, during metabolism, the taste of the drug will be madhura, so which is helping in acting as rasayana. So here under Vaisthapana Mahakashaya, these two drugs are included, like Amrita that refers to Tinospora cordifolia and Datri that which refers to Emblica officinalis. And there are various pharmacological actions can be considered under Rasayana. Like I'll just go through it: antioxidant activity, free radical scavenging activity, anti-aging activity, cognitive enhancer activity, nootropic activity, adaptogenic activity, immunomodulators. There are so many things which can be brought under the ambit of Rasayana. Okay, so this is an opportunity for us to prove all these parameters. The drug, any Ayurvedic drug, can be proven for it. So anti-aging activity, I'm just brushing up. So adaptogenic activity is also very important. And immunomodulator, again, many scholars have spoken about its importance in when it comes to COVID pandemic. So it really helped us to improve our immunity. And nootropics is again a very important concept. These drugs, like including Amalaki and Guduchi, can be brought under the ambit of nootropics. So which helps us to have oxygen supply. And when it comes to mechanism of action, that is a main core topic which is allocated to me. So these 3 points can be considered here. One is Rasayana, which helps in movement of Rasadhatu, that we consider as nutritional blood. Then Agni Vyapara is said. That means it comes in contact with like Agni, that is digestive power, and other Agnis. 13 types of Agnis are told in Ayurveda. So those things are very important for metabolism of the drug, and which also helps in proper ayana in case of Srutas. That means at the micro circulatory channels also, at that level also, these drugs are acting. So that is the thing. So what is Rasayana Karma in Ayurveda? I would like to say that is it is a karma which is mentioned, but under this there are so many karmas which can be brought under, like Medhya, Keshya, Netriya, all those things can be included under the concept of Rasayana. But here,
Guduchi, I'm going to draw this.
I'm just going to conclude. So all these 3 ingredients, which are the ingredients of Rasayana Churna, are having very good Rasayana karma. So when it comes to urinary tract problems or stress-related issues, or immunosuppressing the conditions, in those conditions, this yoga, that is Rasayana Churna, is really help. And the application of this Rasayana Dravyas, which goes a long way, it can be taught from the other point of view also, like preventing and curing the diseases. With this, I would like to conclude. I would like to acknowledge all these personality. And finally, I would like to conclude by saying, eat an Amalaki a day, keep the doctor away. Instead of eat an apple a day, keep the doctor away. It can be the mantra for everybody now. Eat an Amalaki a day, keep the disease at bay. So with this, I would like to conclude. Thank you for the opportunity. Thank you, everyone.
Thank you, Dr. Hegde. Thank you so much for taking us into several details, the table where you showed the Rasapanchak aspects of this combination. Thank you for sharing. Now, before I bring, as you know, when we started, we said we are into the 25th session, and the 25th session of a multi-part series. So we want all our viewers to come and join us again. I hope Hegdeji's presentation addressed Milanji. I hope it addressed the issue about Rasayana versus the question that you raised. And before I bring in, I want to get Baswatiji to comment on the 25 lectures that we've concluded today's bash. Before you join us, you can see, and this is a question for both Ashwiniji and for Diane, who's here, there is a difference in the language that is used. So hold on, before you come, I just want to hear very quickly from Ashwiniji, are we connecting the language, the complexity of Ayurvedic language with the kind of detail that Milanji presented about Tregs and T cells and B cells and endothelial health, and you know, is this something that is achievable, or is it something that we'll have to continue working on? Where do you think we sit. It's a question also for Diana. There seems like a difference in this kind of the language that's used. Ashwiniji, would you like to comment very swiftly on this? We'll have to unmute before you come onto this. And after Ashwiniji, we'll hear from Diane very quickly before we go to Bash to hear best to hear.
Come very quickly. It was nice both of them presented their views. And a lot of literature is already existing if you see from the Ayurveda side of view and from the modern point of view. What we need to do in this context, and that's what we have been propounding, we have to realize the ground realities. When we are saying the people are using it, have you really, aging has been prevented? How much people are using it? Okay. When we are now, let us focus only on Rasayana Churna. A lot of work has been done. We have also worked extensively in different combination of Guduchi, Amalaki, as well as Gokshuru. But when it comes to the Rasayana, as a Rasayana Churna, and what Dr. Milin was asking, the context of Rasayana Churna in the classical text of Ayurveda, Vagbhata, in Uttar Tantra, what is said, it is a Vatatapik Rasayana. That means you don't have to really go to the Kuti Praveshik Rasayana, indoor management, and entire Panchakarma. So this can be used in apparently healthy or non-diseased person. So we have to identify the definite niche where this product can be targeted. Now coming to, if it is person goes into the disease state, in the same classical text, about 4 to 5 stanzas after that, Vagbhata says, you have to temporarily stop that, treat that disease, and then come back to this Rasayana. Dr. Prakash also mentioned about the importance of Anupana. So I won't go into those details. There are so many other factors which are individual related, disease related, environment related. So many factors are there. Okay. But what we can do easily, quickly, I can tell you what we need to do. We have to document our experiences. Then we have to go to the exploratory studies where we can quickly do clinical as well as paraclinical studies with a targeted indication, with a different kind of formulations, as I was referring earlier. And then come back after application of this science and all in vitro, in vivo studies, and as well as clinical studies, then with a value addition, reintroduce it to the society, then we will have a more precise indicated product available in the market, where we have defined our dosage, we have defined our targets, we have defined the duration of the treatment to be taken, and all those details. That is
Ashwiniji, please stay with us. I want to get a quick comment from Diana.
Hi, well, I want to speak back to your comment about sort of the different languages. And I think that the language of biomedical science and the language of Ayurveda has points of intersection, but there are concepts in both that don't overlap. And so I think what we have to do is try very hard to bring both traditions into a common ground. And I'll use an example of the Rasayana Churna, which not only has plants, but has 3 plants. And so from a biomedical science research point of view, we always try and pinpoint the active ingredient in a plant, but it's most likely all of the phytochemicals that work together. So I think that we need to come at it from both directions, that Ayurveda needs to come to the language of biomedical science, and vice versa, that there are concepts in biomedical science that we need to change how we think about. May not be one particular active ingredient, but how all those ingredients work together.
Diana, thank you so much. We have 2 senior ideas. Of course, Harish ji is there, who hosts these events, and also Ashlesha ji. Your experiences very quickly on how you have used this formulation and kind of unexpected results. Harish ji.
Thank you, Dr. Madan ji. I'm treating patients of autoimmune diseases for the last 30 years. I have a very special experience with Ayurvedic herbs. My views on Rasayana Churna is that it should be used as an immunostimulant. It cannot be used as an immunosuppressive, because we have seen there is a report that Guduchi has caused some problem with the patients who are having autoimmune hepatitis. So Rasayana Churna, if will be given to the patients of autoimmune hepatitis, it will cause problem. And similarly, because if you look at the modern angle for management of autoimmune diseases, they use immunosuppression. So it's a powerful immunostimulant. So my views are it should be given only where immunity is low, like in cancers, like in other diseases, infections. But in autoimmune diseases, one has to be very careful. This is my take about Rasayana Churna. Thank you, sir.
Ashlesha ji, before we go to Bashwati.
Yeah, thank you. And I have used actually Rasayana Churna many times, even in kids, and find that it can be definitely used. I know these, each and every herb on it is actually Rasayan, and not only as a Rasayan, to be given after the whole Panchakarma, but this is more as a, which can work at the very developing stage. And it can be very, very helpful. And again, you don't have to give for the whole life of it, but somebody who has really gone for many, the simple as a fever, maybe a kid is suffering from, or a kind of infections. We know it's very common here to have the ear infections and recurring fevers and load of antibiotics and all those things. There also, these can be given and prevented much, the recurrence. So that's what I would say.
Thank you, Ashlesha ji. Thank you so
I
much.
had one more quick question, please, Madan ji.
Please.
I wanted to ask this very badly to Dr. Prakash ji, that I thought you would talk about that one is the combination of the Rasayana Churna. That's how people would generally take equal, each dravya in the equal quantity. How about, do we ever change that sometime? The way we change the Triphala is also 111 and all three are Rasayana. Do we even change? Are there any references, or in your knowledge, you would know that? Please.
Thank you.
Yes, definitely when the amount is not told anywhere, so it should be always equal, like 1:1:1. So that is the thing we are following always in Ayurveda. In case of Triphala, as mentioned, like one part of Amalaki, one part of Vivitaki, one part of Haritaki, like that. So there is no mentioning of any amount, then it should be equal. So if they have mentioned, means I think we need to look at it. So
Are there, the question from Ashlesha ji, are there examples in literature where they have varied the formulation?
Yes. When it comes to the yogas which we prepare from, including Dashamulas. So Dashamula as a main drug. For example,
in terms of Rasayana Churna.
No, Rasayana Churna, particularly as I have gone through the reference of Ashtanga Hridaya Uttaratantra 39th chapter 159th shloka. So even there is only mentioning of the 3 drugs. So as there is no mentioning of any commentary or anywhere, so there is no mentioning of the ratio of the drug. Okay. So once it is not mentioned, it is believed that it should be taken equal.
Equal amount. Thank you. Ashlesha ji, I hope that answers your question.
Thank you.
Milind ji, before we come to you, Bash, we are going cross screen.
Okay.
Comments about the series. We have completed 24, 25. This is the 25th event.
Yes, I'll comment on that and a couple of other brief things.
But be very brief.
Very brief. So I'm going to call this the Tamayana, because Ayana means journey, as Dr. Hegde has said. And Ayana is the journey. So when we say Ramayana, it's the journey of Ram. When we say Rasayana, it's the journey of a drug or a dravya from the Rasa Dhatu to the Rakta, Mamsa, Meda, through the 7 dhatus. And that journey through the dhatus is what creates the Rasayana. So it's important to think about this Rasayana Churna as a journey through the tissues and taking them through the mechanisms that Dr. Hegde talked about. And we did that in our 25 drugs. We went through, some of them halted at one of the dhatus and focused on that. but we went through the journey through the different tissues, and we will continue that journey again, like a layer of an onion, in our next series, series 2 of the Tamayana, as I'm calling it. Tam, of course, as you know, is traditional Ayurvedic medicines. It's the title of this series. And in my file, I call the Tam series. So this is the Tamayana. So 2 other quick points. Tinospora crespa was not talked about in detail, and that needs to be discussed in detail to address the issue that Dr. Johnny mentioned. And he said, I'd like to know what we think about this. And so the simple summary is it was an adulteration. Those hepatologists most likely had an adulteration. This needs to be spread far and wide across the audiences so that they understand that that was not actually Guduchi, and it reflects the lack of understanding of people who are, as they say at BHU, over-smarted. They think that just because they've read a little bit of Dravyaguna that they understand, and they didn't pick it correctly, much less understanding that Guduchi needs to be grown on a neem tree versus a peepal tree versus like a wire fence, and they're going to have completely different chemistry. The third thing I wanted to say, which is very important, is that there was just a comment made about understanding the active ingredient that Diana made. And that is actually evolving. And I just want to make sure that people understand that the FDA has already approved 3 polychemical botanical drugs, 3 of them that are polyherbals. One is from ECGC, the green tea extracts, the cyanocatechins as they're called. The second is Varigan, and the third is crofelemer, mytesi. So it's important that people understand that, actually there's one more too, and I'm forgetting it, but it's important to understand that there's already been a mechanism worked out by the FDA to allow polybotanicals by using what's call a whole systems research approach. And there's a couple of other aspects.
Bash, thank you so much for raising this issue about polybotanicals. The active ingredients that are purified may not contain the soluble or the insoluble fibers that are there when we use the plants in its totality. And we know these soluble, insoluble fibers are very important probiotics, and they help with many aspects of that subtleness within the microbiome that helps modulate many aspects of the immune system. We want to take the final question from Milanji. Could you, Milanji, while you're talking, could you also display that slide where you had some recommendations while you're talking, if we get that up on screen? We have passed our 90 minutes. We are rushing through. Dan, thank you so much for being with us while Milanji gets his screen on. Let me do the thanks here. Ashwiniji, thank you so much for, we still couldn't quite get out of you how we would bring together interaction with between India and Canada. And while Milanji gets that recommendation slide on, there we are.
Subsequent story of Ramayana builds up, and that time we may interact more.
I'm trying to.
You had a slide at the very end showing your recommendations on what you would want to see as research activities for the future. At the very end.
Let's try and see, where was this? Areas of focus, that one.
That's right.
Yeah.
This is for all of us to kind of consider. Thank you, Milanji. You can continue with your comment that you want to make.
So thank you so much. Yes, if I can just summarize a few. It was good to see Dr. Ashwin Kumarji. Thank you, sir, for picking up on that point. I'll go to Harishji. That's you picked up very well what I was trying to say about the immunostimulatory effect and the immunosuppressant effect. I remember we had this conversation almost 15 years ago, and we were looking at this, so we could expound on that. And it is important to identify those autoimmune diseases which would benefit from immunostimulatory and those autoimmune diseases which would benefit from immunosuppressant effect. And it may be that the Rasayana Churna in combination may not have an immunostimulatory, but may have an immunosuppressant effect. That is my take on this. But we need to look further into that as a combination. And that is one of the principles Ayurveda as well, as you know, in the Paishachya Kalpana. That's another topic. So thank you for that. And the other question for Vaid Ashleshaji was that, you know, this is one thing which has always deterred me from using the Rasayana Churna or Guduchi in children with eczema and, you know, skin diseases or whatever other things. At what age can you give Rasayana Churna safely in childhood up to the age of 16 or 18, even because Ayurveda says that it's almost up to 16 or 18 they consider as children, if I'm not wrong. You may, in modern medicine, we would consider 12 years as a sort of...
Milanji, could you also stop sharing your screen?
Yeah, sorry, yeah. So the dosage for that, and that's an important consideration. We would love to know that. And before you give me an answer, I'll just finally talk about Bas. Thank you so much. That was absolutely lovely about polybotanicals, and that's the point I was trying to raise about the contamination. And this needs to be clarified with some of the species of the...
Thank you, Milanji. The issue, Bash, the issue about describing a species, we are the post-genomic era, and every one of those 7,000 plants can be very easily DNA profiled for the mitochondrial DNA or the chloroplast DNA, and we could easily identify. Perhaps this will become a standard, and it should become a standard. Hopefully the institution in Jamnagar, the WHO Center, will make that one of their key points for the future. This is my wish. I don't know if Prakashji, whether you wanted to add something about the use of Rasayana Churna in children. I don't know if Ashlesh wanted to comment on this, but we are running over time. We are 5 minutes past our closing time. So be brief.
Yeah.
Please.
Okay. So Rasayana Churna as such, or Rasayana for that case, so there is no restriction, because from the first day itself, the infant is fed with Rasayana in Ayurveda. Like we have Swarna Prashana, all those Swarnamrita Prashana, like that, so many Rasayanas are told. Like their child, it is given for licking. Like we have Vacha as Rasayana. Like that, there are so many Rasayanas which are told in Ayurveda, which can be used from the day one itself. And regarding the question which was asked, Bala. So in Ayurveda, actually, till 30th can be considered. Till 16, it is their child age, but till 17 to 30th, it is called as Vardhamana Avastha. So then after Vardhamana Avastha, it comes Madhyama Avastha. So that is the thing which is followed in Ayurveda. So when it comes to Rasayana, there is no restriction at all.
Thank you, Ji. Thank you. Ashwini Kumar, before we draw this program to a close, the 25th program to a close, we would like you to quickly comment on that set of recommendations that was made by Milanji. If there is something, whether we can work on that and refine it into something that will be a part of a India-Canada or India-USA collaboration for the future.
To tell you in a nutshell, because we have a very small little time, all these three plants, as I said, have been well practiced and continue to be practiced through the Ayurveda practitioners. So the safety is there. Once the safety is established, people are already using there is already a human usage. What we need to document this usage, these practices of human usage. Okay. And then try to find out the targeted indication of this product, which I have been repeating. So please follow what we have been following for over 3.5 decades, the reverse pharmacology approach. If you do that approach, it will be cost effective, time effective, and more sensitive to the evidence-based product development.
I hope this can become a part of our, Dan, with yourself where you are, with Harish Ji and the Canada India Foundation team in Toronto, and the ongoing work with the University Health Networks network in Toronto. I hope the recommendation that's being made by Ashwini Kumar can become a part of our event for the future. Harish Ji, would you like to make a few quick comments before we draw this event to a close?
Please close the event.
Pallavi Ji normally does this thing of closing the event, but I'm going to have to do it. I might be a bit sloppy here because she does it very, very professionally. I want to thank all our panelists, special guests today. Thank you so much for being with us and enriching the 25th session of our program. Bash, thank you so much for bringing out that point about enables DNA fingerprinting as a way to become a standard for the future for all medicinal plant activities. Thank you to Milanji to bring out how the Royal College of Surgeons might require people to make presentations to convince the fellows of the Royal College of Surgeons and physicians to make the case for Ayurveda. I hope this will become the standard for the future. And we look forward to your guidance in making this happen and teaching all of us how to make these excellent presentations that address. Now, before I draw this event to a close, I want to thank our sponsors, Canada India Foundation, our partners, most of all, the Council General in Toronto, for being a patron for these events. And with Apurvaji coming to Europe, we look forward to continuing support and to take this message across Europe, the message that is coming out very clearly from Toronto. We want to thank our media partner, Tadastu, for taking care of promoting this event on media across the world. The Canadian College of Ayurveda and Yoga, Harishi, thank you for bringing us all together. We look forward to learning more about where the next 25 events. We will start on the 1st of October, I guess, somewhere in October, we'll advertise again. And all the other partners who help hold these programs together. There's a lot of discussions that go on behind the scene before we can come on air. And I hope we've satisfied the kind of curiosity that our viewers around the world will be thinking about and have been thinking about. I thank all of you for being with us. Do join us again